Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. I am very excited to have a returning guest, Dr. Jenna Blasi, joining us today. It's been a few years since she's been on the show, and she's a naturopathic physician in Sedona, and she has blossomed what she does, and she is reaching people all over the country. So we are going to be sharing with her practice and what she's doing and how she's helping women through menopause today. So thank you so much for joining us again, Jenna.
Thank you so much for having me. I'm very excited to be here and excited to just reach as many people as possible because menopause is an often neglected topic and women get kind of pushed to the side, and it's also been greatly misunderstood over the years.
Yeah.
So this has been a fun focus in my practice.
That's great. And why don't you tell us a little bit about your background, because it has been a few years. Some people may not know or remember all of your background. So why don't you share with us kind of your journey into now this fellowship in menopause?
Sure. So the first thing I want to say about my background that I've realized over the years is I think what my best credential is the way I live my life and helping people. Yes, I have knowledge and I'm a naturopathic doctor and I spent 7+ years in school and in residency, and I did a 2-year integrative medicine residency, and I'm constantly evolving my knowledge. But a lot of people know stuff, but are we doing it? There's that gap. The biggest gap for most of us is between what we know and what we do. But then also there is that knowledge gap, because in the day of the internet, there's so much misinformation out there. And so that's the other piece where I'm constantly doing a deep dive into the research with other physicians and really looking at what's true and then how to apply that individually to people. And for my background, like I was a theater major. I was theater and French and biology because I didn't know I wanted to maybe be a doctor. So I was like, I'll do biology. And then I loved theater and I thought, well, I might want to act. And if I've only done science, that won't get me far. And then I was fluent in French. So I was just taking French. And it was in theater that things turned around for me because we didn't have understudies. And they said, you can't get sick. And so they gave us instructions like, if you get sick, get sleep and don't eat sugar and take this vitamin and take this herb. And I thought, what effect will this have if I implement some of these changes when I'm healthy, not just when I'm sick? And that's when I realized how much power we have over how well we feel. And what I will add to that is that we have this idea in our culture that as we get older, that goes downhill, right? Oh, this is, my joints ache because I'm older, and this happens because I'm older. And it doesn't have to be that way. If you actually take care of yourself and you understand the physiological changes and the mental changes and how to work with those, I felt better when I turned 40 than I did when I turned 30. And I felt better when I turned 50 than when I turned 40. I feel like it just keeps getting better. And so I love giving hope. And so like I said, I've been studying with these clinicians, the Confident Clinician Group, where we dive into the research on all areas of health. But I've been in Sedona for a long time, and the average age in Sedona is 62. So menopause has been a big part of my practice always. And now that's kind of the phase of life that I'm in. And so then this menopause fellowship opportunity came up, and I just knew, like, my mind was like, oh my gosh, I can't take more on. And my being was like, no, this is, you've got to do this, because there's so many women to be helped by this.
Yeah. And so why don't we dive into menopause and kind of go and just start with the basics in that, because, and I have plenty of friends who it is affecting right now, and they've told me that they're going through these different symptoms. And it's like, okay, how do we minimize that? Like, what's going on? If you can kind of share with us the latest and greatest and the basics, all of that.
Yeah. So what I thought I would do is let's do first, like, what is perimenopause? What is menopause? When does it happen? What are the stages? And then we can look at what are the symptoms, because some women in this stage can feel like they're going crazy. And it's like, no, you're crazy. This is normal, but we can support you through this. And then we can look at labs and misnomers, or, everyone's like, oh, I got to get my hormones tested. So we'll talk about that a little bit. And then the sort of main treatment areas are menopausal hormone therapy, MHT, which most people call hormone replacement therapy. So we'll get into that, herbs. And then what I'd like to do is kind of go wider with the 4 pillars of health, because that way, one, everybody can benefit from the information I'm talking about, because these pillars of health are key for all of us.
Yeah.
And then I'll talk about how we tweak these and how we address these for menopause and
Great.
perimenopause.
That'd be great. Yes, because we all know women, in that age range.
Yeah. So, in our late reproductive years, in our late 30s, our hormones start to change.
Mhm.
Perimenopause, or what's called the menopause transition, is typically those 3 to 4 years before your final menstrual period.
Mhm.
Menopause, let's start by saying menopause is a day. It is one day where you've gone 12 consecutive months with no period, excluding, of course, some other medical reason for not having a period. So menopause is a day. And once you're done with that, you've hit that 12-month no period mark, you are now post-menopausal.
Okay.
So backing up into the menopause transition or the perimenopausal years, the average age that this begins for most women is 47.
Okay.
However, from 40 to 45, it could happen, these changes, and we refer to that as early menopause. Again, excluding any other reason. So if you are between 40 and 45 and you're having mood changes, you're having sleep disturbances, maybe you're having cycle changes, you do want to rule out other causes like your thyroid. You want to rule out pregnancy first, because we can still get pregnant. And we want to rule out thyroid, and then other things like, I won't go into detail, but like you can have a prolactinemia, which is could be secreting prolactin and affecting your cycles. And so before 40, we refer to that, it's not early menopause, it's premature ovarian failure. So if you're having cycle changes significant before 40, you want a complete workup. So I'm not going to really address that phase, and I'm not going to spend a lot of time on early, because it transitions into the menopause transition at whatever age it's happening. I just want people to know that before 40, 45 and below, you're going to want to rule out, have your physician or your practitioner rule out any other reasons why. Perimenopause in the early transition phase, and again, the average is 47 years old, is when you're having cycle changes that are greater than or equal to 7-day changes. It could be longer, it could be shorter. Some women are spotting more, some women are bleeding more. Women who are obese or who have fibroids tend to bleed more. And a lot of these symptoms, unfortunately, are aggravated by extra adipose, extra fat tissue in our bodies. So this early symptoms that happen for most women are besides cycle changes, are sleep disturbances, mood changes, and hot flashes. Hot flashes tend to be the most disturbing. We can have sleep issues separate from hot flashes, but obviously hot flashes affect our sleep. And then mood. And this is where I said a woman can feel crazy. And testing your hormones in this time is actually, it's not that helpful, because it's like this. It is a roller coaster ride. Your estrogen could be here one day and then here and then here, which is why we feel a little crazy, because most of us are sensitive to those fluctuating hormones. That's why women have PMS. Or if they have PMS, it's because they're sensitive to those fluctuating hormones. So, I tell people, because I like to be true, like I remember a time, hopefully my daughter won't listen to this in 20 years. I remember a time, like she's like 5 years old and I'm in the bathroom just getting ready, and she comes in, all she wants is my attention. I just wanted to scream. I was like, I wanted to be like, get out. And I was like, what is wrong with me? And I was like, oh shit, I think I hormone changes going on. So, so then I looked at how to balance that. We can have, now later, we can start to have obviously bone density changes and genital, I can't talk today, urinary symptoms, symptoms, vaginal dryness, libido changes, etc. I feel like I'm forgetting something big. So this perimenopausal time, there's an early period, like I said, where those cycle changes are greater than or less 7 days. In the later perimenopausal time, we're looking at, you've skipped a period. You're greater than or equal to 60 days without a cycle. And that's considered late menopause transition or late perimenopause. There are no tests that are really diagnostic. Like, well, I want to know if I'm in menopause. It's our symptoms primarily.
Really? Okay.
You can test FSH, but it's very variable. It could be normal, it could be high. So it's really based on symptoms. And there's not a lot that predicts when your last period will happen. There are some tests like a highly sensitive AMH, but that's getting really technical. Most people aren't going to do that. it's not necessary. But if you're in late transition, going 2 or more months without a cycle, you're probably getting closer to your final menstrual period, which on average is at age 51. And so the greatest in the, let's say 3 to 4 years, and in the 1 to 3, especially before that final menstrual period, we have the greatest bone loss. We have our cardiovascular risk starts to go up, and those deep physiological changes that affect our future, which is why it's such an opportune time to support a woman's body. And I'm going to pause this in case you have any questions.
Yeah. So what you've been describing is the years of peri-menopause, where even during that time, you're starting to have the bone density change and the cardiovascular changes. So a lot of times everything you just described is associated with menopause, but it's actually more in the peri-menopause up to that.
Yeah, it's both. But we do want to support it's really in the few years before and after. Like hot flashes start for most women in the later transition. Not all, but like 80% of women or something in this country have hot flashes. And then that gets more in the early post-menopause. So once we hit that menopause point, then we have the post-menopause time, which is the 2 to 6 years after menopause. And that's considered early post-menopause. So there's still a lot of changes. And then some things are going to solidify by that late post-menopausal time, which is another reason why the topic of hormone therapy is so important, because when the World Health Initiative, the WHO, did that huge study, and then everybody grabbed headlines, they called it hormone replacement therapy back then. It causes cardiovascular disease. It causes all these problems. And so women got scared, doctors got scared. So many women came off, but even women who wanted to get it, the doctors were not willing to prescribe. A lot of the study were done on women who were over 60. So when we're looking at hormone therapy, or MHT, menopausal hormone therapy, the benefits of it are determined largely. Some people can't do it, right? For family history, for personal history, contraindications. But the women who are good candidates for it, it's that time around menopause that's the key time to initiate it. And for most women, if you're under 60 or within 10 years of when you've gone through menopause, the risks typically outweigh the benefits. The benefits typically outweigh. So if it's a quality of life issue, you're miserable, you can't sleep, your mood, anxiety and depression risk increases greatly in this time, especially if someone has a previous history of anxiety, depression, or a previous history of like PMDD or other menstrual issues, mood issues. So to initiate this type of therapy before you're 60 and within 10 years, typically for quality of life, if it's indicated, the benefits outweigh the risks. When you start getting 60 and older, it's a different conversation. That's important for women to understand, and their significant others, if they're men or if they're women of a different age, to understand that this is not a medical condition. There's another thing I want to say. This is not a medical condition, which is one of the reasons why a lot of we've gotten away from hormone replacement therapy, because we're not replacing, we're having withdrawal symptoms. And so as estrogen and progesterone decrease and those symptoms, those hormones withdraw from our body, we have a lot of changes, like blood glucose control becomes difficult. Insulin resistance goes up, or insulin sensitivity comes down, body composition changes, bone mineral density changes. And so I forget where I was going with it. Cognitive changes.
But so not a medical condition, you're saying?
Thank you, not a medical. I do want to say quickly before I finish that thought, that testosterone does not drop dramatically in menopause. That's a gradual decline with age. So that's different. And a lot of times women will want to take testosterone, but it's really the estrogen. Estrogen is our anabolic steroid hormone for women. Testosterone doesn't have the same, like free testosterone doesn't increase strength the way it does in women. And so it can be a really beautiful time. So it's not a medical condition, it's a normal transition. And it can be a really beautiful time to find your inner power and find your sisters and get an understanding and step into women, especially, we are so likely to put everybody else before us and put ourselves on the back burner, and kids first and family first. And then there's a career for many women in there as well. And then we get to this stage where our stress response is naturally, like, our cortisol goes up, our stress resilience goes down. We have inflammatory processes going on in the body. The gut microbiome is being affected by the changes in the hormones in a way that now makes us even less stress resilient, and so many issues. And if we don't get out of that sympathetic nervous system, fight or flight, everybody before me, not going to put my own oxygen mask on, it's going to be a much rougher ride.
And I can imagine. And so when you're talking about how testosterone just drops off gradually, is that what hormone, the menopausal hormone therapy is trying to do for us? That we're, instead of having this huge drop in estrogen, we're just trying to gradually drop it down so it's just a smoother transition? Is that kind of the purpose of it?
Yeah, that's some of it, because, and this is where surgical menopause is much harder on the body. If a woman has a complete hysterectomy or endometrial ablation and, doesn't, well, endometrial ablation would be a little different, but if it's a forced quick menopause, there's no time for the body to adjust. As our hormone levels are changing, but like I said, it is a roller coaster in those years. As our hormone levels are changing, our body is adapting, right?
Okay.
So it's we're having symptoms, but it's much less abrupt. And so when we take exogenous hormones and we want to do the bioidentical, meaning they match, the profile of our own body hormones, it's still not this, we're not replacing them, because something exogenous will never be exactly the same despite its chemical makeup as what's in our body. So yes, it can help fill in those gaps where it's not such a big change, and the body can have more time and have that extra estrogen and progesterone to transition more smoothly. But it's not going to have the exact same effects as our own hormones. And that's okay. I have felt pretty good through this process because of the way I take care of myself, which is those pillars that we'll get into.
Right. Because that was the other thing, is for those who would like to try with less supplementation through hormones, can you use exercise to help with that? Because if you think about exercise in general, a lot of people will use it to help them combat anxiety or depression. It helps stabilize the mood. Can you use it during this time period? And is there a specific type of exercise that's good for that as well?
Yeah, great question. 100%. And maybe this is a good segue into those pillars, because movement is one of those pillars. Exercise is a great mitigator of a lot of what's going on, because it addresses oxidative stress. It addresses your metabolism. It addresses body composition changes. It addresses the microbiome and the changes that are happening by improving it. So, and our risk of cardio, it addresses insulin sensitivity better actually than we'll get into keto diet and whatnot, and why that doesn't really work the same way for women. So when I span back out and I go, what are the ways to address this? When we look at health in general, the 4 pillars, when I do talks on Ayurveda, the 4 pillars of health, like those 4 legs of a stool, are, some people say nutrition. I like to say nourishment, because it's nutrition. It's what we put into our body. It's also how we nourish ourselves. Like I said, we have to find that joy in our lives. And a lot of women enter this phase and they're just, I'm not living my purpose. I don't know what I'm doing. I've been living for other people for so long, and now I'm unhealthy and I don't know what I want to do. So nourishment, and I would say, again, that's both food and how we nourish ourselves and find our joy. Movement or exercise, and I can address that pillar first because you just asked the question. Sleep, and I do want to say with sleep as well, we want to rule out, there are something like 54% of women, I think it's between ages 45 and 55, don't quote me on that, have sleep apnea or restless leg syndrome or some other undiagnosed reason why they're having sleep issues that's sort of separate from this. And the 4th is sacred space or meditation or stress management or prayer or that sort of, and those are those 4 pillars. And we know if one's missing, it's a wobbly stool. If two are missing, these are the foundations of health. So when we look at the perimenopause or menopause transition years,
Yeah.
I'll speak to exercise
Yeah.
first. Our needs do change
Mhm.
because what's happening in our bodies and our bone density are so rapidly changing. And so we know, most of us know, resistance training is huge. Resistance training, weight training, heavy lifting is really important for maintaining that bone mineral density and having body composition. But what's interesting is, as we get into this stage of life, it actually isn't enough. We need HIIT training, so high intensity interval training, or SIT, which is like sprint interval training, or a combination of those. And we also need like plyometric training, because that actually doing like vertical jump, and then I know the joints are another issue, and that's a whole nother topic, but there are ways to do it and to still get the same effects. And some studies have found that the plyometrics actually have a greater effect on your bone density than resistance training.
Wow.
All of these in their own way are effects like improving your oxidative stress, decreasing inflammation in the body, and helping insulin sensitivity, and the things that I just mentioned. And so having a combination, and then I would add also mobility, like functional mobility. Like we need that recovery time. So what happens is women go into this phase of life, and then they're like, oh, I need to eat less and train harder because my body is changing and I've got belly fat and all that. And that can lead to problems. So they start doing crazy diets and they start eating less. And then they get into like a low energy availability state, which actually puts more stress on their body, raises their cortisol more, and tells their body to store fat more. And then they're training, but not recovering. And so their body's not getting the adaptive benefits that it could. But our protein synthesis goes down. And so our muscle protein synthesis, because estrogen was our big instigator of that, our anabolic hormone. And so the exercise is that external stress that can help with that muscle protein synthesis. But let that segue into, we actually need to also be eating more protein. I mean, I think protein is important really through all phases of life, but in menopause, it becomes that much more important, and the timing of it, and making sure that we're fueling before and after meals before and after workouts rather than starving ourselves. And so if we look at the diet and the nutrition piece in this time, women will start to, oh, my partner, if he's male, did keto, he did great, so I'll do that. It does not have the same benefits. It does not have the same outcomes. In fact, in many times it has opposite. So like men, their insulin sensitivity will improve, their insulin resistance goes down, like it helps diabetes and weight. Women, it either doesn't change it at all, or if they're pre-diabetic, can aggravate it. And the thing to realize is that these studies that have been done where people say, oh, the studies show that keto is good, or this, they were done on obese men for the most part. Sedentary, obese, sedentary men are who like primarily the ketogenic diet has been studied on. When they studied it on perimenopausal and postmenopausal women, the women did not have the same outcomes, and they had adverse outcomes, and it can lead to thyroid suppression because of that. It's not what we're looking for. Now, in sedentary, non-exercising women, yes, they might lose weight. So there's an exercising perimenopausal, postmenopausal, non-exercising. If you're non-exercising, you might get some benefits from keto. You might lose weight and not have as many cravings, can help with the mood. But this is at the expense of increased cardiovascular risk, increase of some other disease conditions and inflammation, that it's just not worth it. Like there's other ways to release weight and help your mood that aren't going to carry the same risks. Wow. And so looking at, intermittent fasting, that's a big question that I get a lot. And I've always kind of gravitated personally towards intermittent fasting because of the autophagy and like the longevity benefits. And then sometimes I wonder if it's like I really asked myself, or is this left over from body dysmorphia years and it feels good to restrict calories? Like sometimes I have to check myself and go, am I being intuitive? Like, am I hungry and
Yeah.
trying not to eat, or am I just sort of naturally? But the thing with fasting is if you're working out and you're peri or postmenopausal, you're not helping your muscles grow. You
Okay.
need to fuel yourself before and after that workout to really get that external stress that leads to that muscle protein synthesis.
And does it matter with all the hormonal changes going on, does it matter the time of day for exercise, or just try to get it in?
That's a
That
great
been
question
looked at?
too. Yeah, it matters more the timing of how you're fueling yourself,
Okay.
when you exercise. And I think varying that stress response. So like for a lot of us, we want to get up and get it done in the morning,
Yeah.
and that works well. And that's
Yeah.
fine if you can have a little protein, maybe a little carbohydrate, do your training. But there's a benefit to training later in the day if it means you get more sleep.
Yeah.
Like women are like, I get up at 5 a.m. every day. Well, maybe you should sleep in sometimes and then do it later in the day.
Yeah.
And then, and this is not, I don't have research on this, but just like from a Ayurvedic standpoint, we want to look at, although there is research to support like your cortisol response, we want to look at when is our natural high energy time of day. So what I would say about timing is you want to avoid, like, if you're low energy availability, well, or have you underfueled?
Yeah.
And or is your cortisol not in a place where you're going to then put a stress on your body to try to do something? And a good way to tell is, do you feel better when you're done? That's one way. Or are you worse off? Because most of us feel better after we exercise.
Yeah.
And then the thing I didn't mention is for people that love like long distance running and spin classes. And it's funny, I taught spin for years, and then I naturally, I hadn't put this together actually completely until right now. I stopped liking teaching around the time I was, I think, becoming more perimenopausal.
Interesting.
What I would say is, so like our stress response, those longer cardio, and I did hills and stuff, but those longer cardio workouts, running, spin, are not our friend for the most part in this time of life, because they're just going to keep our cortisol high. And already we need to like get into the parasympathetic and out of the sympathetic. And if you're just running, which is why HIIT and sit, it's good, because you're getting those the high intensity that your body needs for your composition changes in your metabolism without prolonging increased cortisol and stress hormones.
Yeah.
That doesn't mean there's not a solution for people that love running. Like there's ways, but then you want to vary it. You want to mix in those other types of things that we were talking about.
Yeah. And that's good to know, because I mean, I'm into long distance running and I have a lot of friends who do it. And it's good to know also, if people are going out for a group run and someone's not feeling it, that could be part of the reason, and maybe not to push them to be like, hey, just join us, like be sensitive to what's possibly going on in their bodies.
Yeah.
That's great. And kind of, can we transition into sleep a little bit too? Because you mentioned sleep disturbances, and I have to say, pretty much everyone I work with, sleep is an issue. And when they learn to calm down, sleep improves. But with hormones, that's a whole nother factor.
Yeah, there's so many factors that go into sleep, right? So that the calming down, the sleep hygiene, are you on screens before bed, evening routine, regardless of stage of life, I would start there. Get the TV out of the bedroom. Put your phone, if it needs to be in your room, on airplane mode and get off it. 20, 30 minutes, an hour before bed, begin that evening ritual. But there's also hormonal changes, obviously, that are affecting sleep. And so this is where, for some, the menopausal hormone therapy can be helpful for getting a deep night's sleep. There are herbs that can help through all these transitions too. A lot of women in this phase and in general, they're wired and tired, right? This is a big thing with sleep. Their circadian rhythm is flipped. They're up at night and they're like, I'm tired, but my mind is just going, I can't. And that's where, doing the journaling exercises and trying to structure our day in a way that we're not worried, like thinking about it the night before, waking in the middle of the night. And then, there's herbs that can support. And so there's stimulatory type, most of them are adaptogenic herbs. And so like sage is a big one for hot. So sage is a big one for hot flashes. It's like, is it hot flashes that are causing the sleep disturbances? Is it just a change in hormones? Is it the cortisol? there's so many pieces. Is it the way that you're eating? Are you eating too close to bed because you're giving into cravings? Like, and so we want to make sure we're fueling enough and hydrating enough during the day, because that can be another reason. Oh, I drink lots of water at night, and then you wake to go to the bathroom, and then the mind starts going, which is also where that fourth pillar of sacred space and meditation weaves in, is important. But so supporting with hormones can help, but supporting with herbs can help. And so looking at even the stimulatory herbs like ginseng, rhodiola, the ones that we think of for maybe more energy, even those can help us with sleep, because they're actually supporting our system. So they're helping us get out of that deep fatigue, wired and tired, and balance a little bit more. And then there's herbs that are more calming that can also have that effect. And interestingly, rhodiola is considered stimulatory, but it also is calming in a way that some people can take it before bed and it helps with sleep.
Really?
Yeah, mostly I would say take it earlier. Those types of herbs, take them earlier in the day. Some people, they find that they can. And then ashwagandha is an Ayurvedic herb that's been used for years, that is works for most constitutions and is calming and can help that adaptive stress response. So figuring out what the cause is, I think, is a big thing. And it's often not one thing. The hormones are changing. If anxiety and depression and mood have worsened because of this transition, that will worsen sleep. Hot flashes can worsen sleep. That increased stress response can worsen sleep. So that exercise balance, the right foods, adding appropriate nutrients, making sure you have the nutrients that you need to feel balanced. If it's appropriate, decided with your practitioner for the hormone replacement. I almost said hormone replacement, for hormone therapy. That can help as well. And just as an aside, a lot of women will come to me already on, say, estrogen and progesterone creams, but it's the oral progesterone that has a sedative effect. So if sleep is an ongoing issue that the hormone therapy is not addressing, you want to make sure you're on the right dosage. You're working with someone that's really skilled, that's looked into the research, that knows the proper way to prescribe, but also progesterone, oral progesterone at night. I usually do it in a sustained release, because I have women that wake up during the night. So then it's a slow release through the night that can really benefit sleep as well.
Yeah. And that's amazing too, when you think about the hormones is really kind of helping multiple factors, and even sleep and how you can use that. So one thing I just want to ask, when you were talking earlier about your hormones are fluctuating up and down so much that it's not useful to check your blood hormone levels all the time. So when you start to do something like maybe the oral progesterone, where it's slow release and you can feel it, are you going based on symptoms to determine, are we at the correct dosage, or how are you determining what is the correct dosage for a person?
For the most part, it used to be that I would at least run hormones if I was doing hormone therapy. And now the current guidelines are like, it's not even necessary, except for testosterone, because that's a controlled substance. It's not even necessary. And then, so a lot of it is symptom based, but if a woman's on estrogen, she needs to be on oral progesterone to protect her uterus if she has a uterus. And I know that I'm talking mostly in the cis, non-binary way of not addressing like transgender issues in this. And I just want to say that there's not a lot of research. There's not a lot of information on that population. So coming from my bias of where I'm at, who I am, I just want to be clear that I don't exclude anybody in my terminology. And so when a woman who has a uterus is on estrogen, you need to be on oral progesterone, because the estrogen is potentially increasing the lining of the endometrium. And so that is based on research. It's 100 milligrams that has been shown to protect the lining, and we don't have to test. We used to look at blood levels to see if they were where we wanted them to be, and now they're just saying, no, we actually know this amount will cover it. So from that point, if she's on estrogen, She kind of has to be on at least 100. Hopefully she tolerates it. And then if that's not managing the symptoms between the two, if she's on both of the hormones, then adjusting the dosage from there, because some do need more, some need less to get those effects. And if that's the only thing they're taking, then yes, I would do less and do it clinically.
Okay, that makes sense. Yeah, because I can imagine it's like a moving target trying to figure out all of this, especially since everyone's so different. So it's nice to find out at least there is a cutoff for oral progesterone as people are going through this.
Yeah.
So, good.
Well, and the doses, a lot of people were doing biased, like that was a big, which is doing estriol and estradiol. Estradiol is the main hormone I'm referring to when I'm referring to estrogen. Its anabolic effects, and estriol, or E3, is one that's used pretty effectively in vaginal suppositories for vaginal health issues and dryness and painful intercourse. But to put women on biased, I think the reasoning was like I don't know, that it's safer or something, but the research is really clear on using estradiol, and that's what's going to get into the receptors on the brain and have a greater effect. When we go through menopause and we're on the other side, estrone, E1, becomes our main estrogen. So we still have estrogen, but it's E1, and it's 10 times weaker than our estradiol. It doesn't have the same effects.
Got it.
I don't know what that was in relation to, but just knowing, how to dose, what dosages to do, working with a practitioner that understands.
Yeah. And so kind of transitioning to nourishment for you, you'd mentioned protein. What else is important just in general for nourishing someone during this time so it supports sleep and exercise?
I would say, and this is true sort of across the board for most health conditions and cardiovascular health, it's that Mediterranean type diet. You're eating mostly fruits and vegetables, and that's half your plate is fruits and vegetables. And some women may not digest fruit as well. So with that increased insulin sensitivity, we don't want to eliminate carbs. But if a woman is still really struggling with belly fat and doing all the various things, then we might look and go, okay, are we eating a lot of high glycemic fruits? Now, if you're training, it's different. If you're really exercising intensively, your body is really going to benefit typically from that. Same with whole grains. We've just gotten so afraid in our culture of like any carbohydrates. Now, after this time when we do have more insulin resistance and our blood sugar is higher, do we want to modify? Sure. Again, half the plate, get your carbohydrates from those vegetables. You get, some of your protein from those vegetables, and then divide the other parts of the plate with, a fist size of those whole grains and complex carbohydrates or a sweet potato, and then your lean protein or plant-based protein. There are studies that have shown, and I'm constantly looking at the research, and we're constantly finding out more, but the gut microbiome changes, and that's a big piece in our health. And so a lot of what happens for women, whether it's their mood, their bone density, like a lot of it is related to the gut health. And so that's where stress and sleep and all those pieces are important. You can take, probiotics that help with the flora that's specific to what's going on. But eating lots of fiber is going to help your gut microbiome not have the adverse effects. It's going to bring that balance back to where it needs to be in a way that's decrease systemic inflammation and ultimately help the cells that stimulate bone remodeling, et cetera. And so lots of fiber, like 30 to 50 grams, lots of foods. Meal replacements should be supplements and not replacements. Like you should be eating whole foods, and eating nuts and seeds and that variety. And even the protein needs, as they go up, especially if you're working out, your protein needs are increased, but it doesn't just have to come from your chicken or your salmon or your tofu. It could include, like, what are you getting from some of the whole grains? What are you getting from some of the nuts? What are you getting from, there's other sources that can help us meet that need without feeling like it needs to be huge. And, and so they found that women who were vegetarian or plant-based had better results and better outcomes in this time of life. And one of the theories behind it is that because of all the fiber and all of the whole grains and fruits and vegetables, that their microbiome actually was in good shape. But Mediterranean diet has been studied across the board. And I know there's a lot of variations within that, but it is a plant central diet.
Mhm.
And then for those who tolerate dairy, they may have some dairy, those that eat meat, but it's more fish. The
Mhm.
actual meat, and especially red meat recommendations are much lower. And because our cholesterol is going to go up as we get older. And so we want to decrease our saturated fat, and we want to limit our red meat consumption, because that will contribute to what's already happening from the hormonal changes in our body.
Yeah, no, that's amazing. And the last pillar of your 4 pillars of health, sacred space, meditation, what can you share on that?
Yeah, you can see where these are all weaved in, right?
Yeah.
When we're eating good foods, we feel a little better. And when we're moving our body, it helps our mood, and it helps with all these things, and it helps us make better food choices. And when we make better food choices, we typically want to exercise more. And when we're sleeping well, we want to eat right. And they're all tied in, and the meditation piece is tied in. So having that time daily to go inward and to get into that parasympathetic mode. So for some people, that's nature. For some people, that's prayer. For some people, that's meditation. I look at it as like just quieting the mind. I do feel that connection with source is really important, and that higher self. And we can get information in that time, but also just calming down the body. And so there's great apps, which is why I never used to have my phone in my room. Now I've got Insight Timer. So I put it in airplane mode. I go to sleep to high frequency music or affirmations. And, I have my own meditation practice in the morning, but kind of like when you work out, you want to bookend your workout with the right type of fuel. I feel like bookending our day with the right type of mindset, and having that de-stress in the morning sets the tone for the whole day. Having that de-stress at night can help us through the night. And, there have been studies, speaking of mindset, because we're talking about meditation, but meditation affects our mindset. We tend to have a more positive outlook when we can recenter. And they have done studies that women's attitude, like going into menopause, how they view it directly affects the symptoms they have. And I don't have the stats to give you, because I didn't have a chance to look up that study again, or those studies before we met, but this is actually my research topic in my fellowship, because I'm passionate about the power of our mind. And so women have fewer hot flashes, they sleep better, like they go through this transition dramatically more fluidly or successfully when their attitude about menopause is positive.
Wow.
Which is so many people look at it, and the same thing with our periods, right? When we're cycling, it's, it's the curse. It's, I remember Robin Williams did a stand-up, they call it your friend, but I don't think it's a friend. Do you? And we're just the idea of we're just subject to this terrible time of month. And it really does a disservice to what's possible.
Yeah.
So I feel like menopause is similar, where it's misunderstood. And then women are told, oh, you're just stressed. You're just stressed. That's why you're having all this. No, we're having actual physiological changes, and our immune systems are going down because of this response and all these other things. So everything we can do to boost our immune system, and our nutrition and our sleep are part of that, and our exercise. And then this, because gratitude changes. There was some I don't think it was research, double blind placebo, but they took people in different states of emotion and tested their sweat, and people that were angry or other, so what we would deem negative emotions, had acidic sweat. And then when people went into gratefulness, it went alkaline.
Interesting.
So imagine our sweat is acidic. What happens if acid sits on you for too long? It begins to eat away.
Yeah.
The effect of staying in those negative, ramped up, high cortisol, road rage emotions, which can start to happen as our, hormones are doing this.
Yeah.
So when we can offset that with our own practices and take that control and be this is a beautiful time of life. I remember when I was younger, I always used to think I felt this wise woman inside of me. And as I got older, because I knew 30-year-olds that were I can't believe I'm 30. They were just miserable about the whole aging process. And I always loved that I felt I was getting closer to being one with this wise woman inside of me.
Yeah.
And so I think that those kinds of attitudes have been shown to really make a dramatic effect on how we experience and what kinds of symptoms that we have.
Yeah. Yeah. And I totally believe that, because your body responds to what your brain is thinking. So if you're in this mode of some kind of negativity or anguish, your body's going to respond to that because it doesn't know if it's really happening or just happening in your brain.
Exactly. And that's
So,
like when we look at adrenal
yeah.
stress, our body doesn't differentiate,
Mhm.
from life-threatening stress to like, oh,
Yeah.
I got this deadline, or oh, my phone's
Right.
not working. It's just, it's stress.
Yeah.
The body's having that response. And then the power of the mind. I wish I had revisited this one study
Mhm.
that we were doing in my group on, I think it was on patients with irritable bowel or Crohn's or ulcerative colitis. And so like removing various trigger foods and then all the improvements they had, and then adding foods back in and telling one group that they were trigger foods and telling the other group that they were not trigger foods.
Uh-huh.
And that those that were told it was a trigger food, even when it technically wasn't, went back to baseline. They lost all their improvements.
Wow.
Their belief that that food was a
Yeah.
trigger. I feel like we've gotten like this with gluten at this point, gluten
Mhm.
and bread. And I'm not saying there aren't issues with it. It's a whole nother topic, but we're so afraid, like, oh, gluten, that it's like, we're going to have like, oh, my stomach, we're going to feel. And yes, I'm not saying there are not real effects, but our
Yeah.
mind is powerful. There's an old expression, yogis can digest rocks. I'm not suggesting we eat rocks, but when I go out to eat and I know it's GMO or I know it's organic, it's like, this is going to be beautiful. Like, I'm not going to
Yeah.
stress about it because the stress is
Yeah.
actually more detrimental.
Yeah. Yeah, it does.
Yeah.
Yeah, that's amazing. So with all these factors, obviously they cover, like you said, it covers everyone. And for women going into perimenopause, menopause, it's good now if you're going into it to even get into these habits. So just in case when you start having those hormonal fluctuations, you feel like you don't do them, at least it's instilled in you, right?
Yeah. I mean, I think in Japan, they don't even have a word for menopause.
Oh, wow.
Like they don't have the same symptomatology unless they live in the West
Mm-hmm.
that we do. Like, and aging is seen as a beautiful thing. So it's this like celebrated transition. And that's why I said it's a time where we can gather and feel strong and feel powerful. And, we were laughing before we got on, right? Feel like a badass. And,
Yeah.
and yes,
Exactly.
and ingrained. And here's the thing is, we're not victim to this. Like, this is a natural process. It's going to happen, but we can make those choices to take action. And that's what I talk about when I do webinars for the type of programs we do in my practice.
Yeah.
It's like, are you really ready? We have to be willing to take responsibility for our part in this journey. How we eat. Are we moving our bodies? Are we doing what we need to do to sleep properly? Are we doing a daily meditation practice? And then, sure, fill in those gaps, but those pillars go such a long way. And then those pillars affect the gut. And then in my practice, we also do like a full gut repair because 85+% of our serotonin comes from our gut. As estrogen decreases, our serotonin also decreases, which is why there's mood issues and craving regulation issues. And so restoring our gut from years of medication abuse and stress and poor sleep and eating on the run and all those things is crucial for getting the effects, which is why if you just change your diet, but you don't reset and clear and nourish the system, you're probably not going to get the same benefits.
Yeah, so we need all of it. So now I know you do community wellness programs. You've kind of shifted your practice a little bit. Can you share what that all involves and how people can learn about it?
Yeah. So I mostly treat people in Arizona. I'm working on expanding both my offerings and what I'm able to do around the country, because I want people to have access to wellness everywhere. And in my practice, we do these comprehensive wellness programs. So I do webinars where I talk about these pillars of health and how we lead people through. And what a lot of people are missing is just a system. So we put this system together, and then in the webinars, it's part going through the system and it's part getting us emotionally involved in how we want to live, because most of us have accepted surviving.
Yeah.
That's not acceptable. Like, we can thrive. We can thrive at any phase or stage of life. And when are we willing to say enough is enough? Like, I want to live my best life. We all have a purpose. And then somebody listening might go, well, I don't really have a purpose. We all have a purpose. And so it's like, are you living it? And I mean, it could be photography. It doesn't have to be like Mother Teresa. Like, we all have something, whether it's within our family, within our community, on a larger scale. And so I do webinars and I talk about these pillars and what are the essentials and things that are missed in labs and things that should be run. But really, how do we want to live and how do we face our own fears? Because the longer we're ingrained in our pattern, the harder it is to really do something different, which is why we see this weight like this with people. They're doing all the things and they release some weight and then they stop and they gain it. And then they're like, enough, and they go back and they go, are we ready to break this cycle and really change our minds and change our habits in a way that's, like you said, it's instilled in us, it's embodied. So we do these programs, but my goal with the programs is this is now a system for the rest of your life, that you're going to feel amazing and you're going to know what your body needs and how do you figure out how to keep it healthy for you. And if your diet has a fancy name, it's probably not sustainable.
Yeah. It's a temporary start and end. Like we want it to be lifestyle changes.
Yeah. It doesn't. And so if people come in and I'll say like, what's your nutrition? How do you eat? And they give me a list of all the things they don't eat. Well, I can't eat corn. My digestion's fine, but I can't eat corn. I can't eat dairy. I can't eat gluten. I don't eat this. I don't eat that. And I'm like, your digestion's fine? Doesn't sound like your digestion's fine, and also like, this is how you think of how you eat, all the things that you can't do. So
it's a negative outlook.
So kind of getting in tune with, because we are eating foods that are causing inflammation, some from the foods themselves and some because of the health of our gut. So let's clean up the gut, get all the crap out, and then build you back up and figure out how amazing you can. It's been really big. I mean, I got really good results in my practice before, but seeing the total transformations, because I get to see people really through this whole process, is, people like, they'll come at a follow-up and they'll say like, yeah, I've released 30 pounds and I have a healthy relationship with food now. And I don't have headaches now and my energy is up. But what really moves me is when they say like, I'm more confident. I've released a relationship that was toxic for me. I'm like in my power now. But once you feel that, your pants fit better. That's great. But feeling that deep, deep wellness within is something that typically we really want to hold on to. That can win over like how good the cookie looks, I tell people, it's just about weight. The cookie's going to win every time. We got to go a little deeper. How do you want to feel? We're chasing a feeling, not a look. I mean, we all want to look good, but it's because of how we feel.
Yeah. And it's funny when your appetite and your cravings start to match how you want to feel, that's when you really find a shift, and all the other temptations just become frivolous. You just don't even think about it. You're like,
100%. Most people, it's like they're led by their cravings, their addictions, their 80% of the time, and then 20% of the time they'll go down like a healthy route, right? Let's flip that, where you just feel so good that deviating from that is the exception, instead of doing the healthy thing being the exception. I did healthy and healthy. I was going to say good. I don't like the judgmental terms, like I'm being good, I'm being bad. And there's all this shame and blame around it, which is not healthy. You can't, if you're here, shame and blame, and you want to feel here, you can't get here from this level. You have to kind of come out of that and shoot for higher. And I remember when a patient said to me, she said, I remember you talking about getting addicted to feeling good. And she thought, I don't know. And she said, I'm there. Like, it's so amazing. Like, I'm there. And my husband, there's ice cream in our house all the time. He's always buying, he eats relatively healthy, but buys crap. Like, if it's on sale, cookies, like all the, it's not a problem for me. Years ago, it was like and if sometimes I want it, then I'll have some, but it's not a downward spiral. For most of us, it's like one bite and then forget it. And then, on Monday or after my birthday. And it's like, no, now, only now. And let's feel good. And then, but also live our lives, not about a life of like, it's like you said, it's a choice. Like, it's not hard for me to eat healthy the majority of the time.
Right.
Yeah. And
Right.
when we were at Disneyland this summer, I had some ice cream, but I didn't have it every night. And
Mhm.
still felt good.
You're still good. That's great. So where can people go to learn more about your
So,
program?
well, we'll post a link to the
Mhm.
webinar. I have a webinar
Yeah.
coming up this Tuesday, but my website, or you can find me on Facebook, Dr. Jenna
Mhm.
Blasi, and
Okay.
then you know when other webinars are coming up.
Great.
And I'm
That's great.
working on my Dr. Jenna Blasi website.
That's wonderful.
Updated
Well,
in the near future.
yeah. Well, I appreciate you taking the time today. Thank you so much for
Thank
joining
you as
us and
well.
sharing. That was wonderful, great information, and I'm just glad to share you and what you're doing.
Yeah, I appreciate that, and I appreciate being here. And let me know if you have, I don't know if there are follow-up questions. Do you have like a do people just ask them on YouTube if they have?
Yeah, and we can always comment, and I can always make sure that all those questions get answered. So we will get it all taken care of.
I will
Yeah.
preemptively say a lot of people like to do like the Dutch test,
Mhm.
and the metabolites aren't necessarily representative of
Okay.
what's going on in our bodies. And so people are spending hundreds and hundreds of dollars on labs that
Yeah.
if they put these pillars in first, they might not even need that information to
Yeah.
balance. So
Yeah, it's true. It's like, what can you do first and then test afterwards and see what are you still missing? Totally
absolutely.
agree.
Yeah.
But
So
well, thank you so much for your time
thank you so
today.
much.
Thank you all for joining us today. Have
Yeah.
a great rest of your weekend, and please check out Dr. Jenna Blasi's information, her website, follow her on social, and we will see you again next week. Thank you all. Bye now.
Thanks so much.